Hello, my name is Dr. Dewan S. Raja. Today I will discuss about vitamin D toxicity, also called hypervitaminosis D. Vitamin D toxicity is usually caused by excessive vitamin D supplements. It is not usually caused by exposure to sun ray or by getting vitamin D rich food. It is caused by excessive vitamin D supplement in most of the cases. This is the most toxic of all vitamins. High doses can cause loss of appetite, fatigue, weight loss, constipation, nausea, thirst and daze, dehydration, weakness, polyuria, that is increased frequency of micturition, hypercalcemia, because vitamin D increases the absorption of calcium, bone pain that may be due to osteoclastic activity, ringing in the ear, also called tinnitus, high blood pressure, arrhythmia, deep arrhythmia of the heart, the normal rhythm will be lost, deposition of calcium in the arteries, so it will enhance atherosclerosis, metastatic calcification to the soft tissue like kidney, even inside the teeth pulp of the tooth may have calcification. Stone in the urinary system, we call it urolithiasis. There may be renal failure. Okay, so vitamin D toxicity is associated with multiple drug like that of thiazide used in case of hypertension. This is a diuretic. Digoxin, that is used in heart failure. Estrogen replacement therapy may lead to vitamin D toxicity. Antacid, specifically the conventional antacid, which are usually chewed, like calcium containing antacids. Then anti-TB drug isoniazid or isonicotinic acid hydrazide. This medication may lead to hypervitaminosis or hypervitaminosis D. Hypervitaminosis, that means vitamin D toxicity. Hypervitaminosis D occurs with vitamin D in a patient existing health problem, like patient has kidney disease, liver disease, tuberculosis caused by Mycobacterium tuberculosis, hyperparathyroidism, sarcoidosis, histoplasmosis. So we may get hypervitaminosis D if the person has these existing diseases. If the person take vitamin D supplement, he even in his normal diet, due to this disease, there may be hypervitaminosis D. Usually, the supplement causes toxicity, not the diet or exposure to the sun ray, except in severe condition of some diseases like this. Vitamin D toxicity, diagnosis of vitamin D toxicity. How can you diagnose that? Monitoring the blood levels of vitamin D, calcium, because vitamin D is always intake associated with hypercalcemia, and also phosphorus level of the blood is important to us. Urine test, the amount of calcium in the urine. X-ray of the particular bone like the spine or the pelvis. ECG or electrocardiography to look for any type of arrhythmia in the heart. So these are the diagnostic process for vitamin D toxicity, diagnostic tools for diagnosis of vitamin D toxicity. Okay, so prevention and treatment. Prevention, always taking RDA vitamin D, required daily allowance vitamin D. It should be around 600 international unit a day. This is the recommended daily allowance RDA. This is also guided by FDA, Food and Drug Administration. It should be 600 international unit a day. Discontinuation of vitamin D supplements and restricting dietary calcium in case of hypervitaminosis D or vitamin D toxicity. Severe hypercalcemia is a medical emergency and is treated by intravenous infusion of 0.9% sodium chloride. We need multiple liters of sodium chloride infusion to get rid of hypercalcemia, and we need to monitor the blood calcium level, vitamin D level, and the phosphorus level. If this does not work, or in addition to that, this is the treatment of choice for that, then we need to, some physician like to give steroid or bisphosphonate in addition to the severe hypercalcemia, in addition to the 0.9% sodium chloride, that is the isotonic normal saline, plus steroid or bisphosphonate. Is the mainstay of treatment is this sodium chloride. We may add that. And that's all about the vitamin D toxicity. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.